All right, so we're going to take a tour of the core. Let's see what I did there. From outside to in. Now, depending on your definition of the core, some people would say that we're literally just talking about any muscles on the trunk. However, other people would include muscles such as the glutes. Why? Because they actually have an attachment, a fascial connection, fascia just being a type of connective tissue, up into the thoracolumbar fascia here, which is essentially, you could think of it as like an internal weightlifting belt, kind of internal belt here, which has links through the glutes and also through the lats as well. Lats, as you can see, directly feed into the thoracolumbar fascia here and that posterior support. And actually, there are several. This is going to do another video on this on the core slings, but the lats on one side and the glutes on the opposite side creates what is known as the posterior oblique sling, one of the core sling concepts. So there you go. Depending on your definition, you may well include the glutes in the core. If we come around to the front, that's some of the muscles on the back on the most superficial layer. And if we come around to the front, everybody's familiar with the six-pack abs. Whether or not they're visible or not is another question, but I promise you they're there. We've all got them. The rectus abdominis being this muscle in question that we can see here. We've also got the external obliques, and actually they aren't the only obliques, because if we take a tour, if we take our tour a little bit deeper and we take off some layers, you'll see that we've got the internal obliques as well. So we've got two sets of obliques that help us, particularly. You can see the fibers here are sort of more diagonally or horizontally orientated, meaning that they play, they're at their most significant advantage when it comes to motion in the transversal or that rotational plane. So there you go, a bit of a nicer glimpse of the rectus abdominis there. We come to the back once again. Now, the rectus spinae or the paraspinal muscles, in reality, we often refer to them as collectively as a group, because in reality they're made up of lots of individual muscles. You can see the longissimus being one of those many paraspinal muscles. But essentially all you really need to know for now is that you can see from when we looked at the lats before that they aren't right on top. They're a layer slightly deeper than some of those other back muscles. But if we just fade the others here, let's go back on the rectus spinae muscle, and if we zoom out, excuse me, you can see the length of where they run. So we've got that attachment into the thoraco lumbar fascia again, all the way down into the sacrum, actually, into your tailbone, and they're going to really help our spine to resist essentially flexion, or resist that forward bending. So when you're doing a deadlift, or when you're doing a squat or kettlebell swing or whatever, particularly anytime you go to bend forwards, they're contracting to help maintain that neutral spine position. And as you go to lift up, if your back is in a rounded position, you go to extend and come up, they're going to help. They're going to be one of those driving forces to help to do that motion. All right, we're into the middle layer now of the core, and this middle layer can be referred to as the core house or the Coke can. I don't know if anyone else calls it that, but I do, and I'll show you why in a second. Essentially, though, it's made up of the following muscles. And if you want to think of this as a house, then the diaphragm forms the ceiling of that house here. The diaphragm being your main primary respiratory muscle, which is what its typically, or most notably, known for, often referred to as a misshapen dome. What else is it known as? A jellyfish. You can see it's got the attachments through the inside of the rib cage here. This is the xiphoid process, which is essentially like the kind of tip of your sternum or your chest bone. But it actually also has attachments to not just the bony attachments here, but also to many of the muscles via common fascial connections, like your QL muscle here, for example, your psoas muscle here, for example, and a lot of others. I'm going to do a separate video because that actually the diaphragm in itself is a huge topic. But anyway, there's the roof, if you like, of the core cylinder, the core house. When it comes to talking about, let's go through the floor next. So the floor then, if we flip round, the floor is, I'm just going to highlight this muscle here. I'm talking about the pelvic floor. Now, in reality, I've just highlighted one muscle here, but in reality, the pelvic floor is a group of muscles that control bladder and bowel function. And they are essentially the core floor, if you want to think about it that way. So moving on then, the back wall of the core house is that we have the multifidus here. Now, the multifidus is a muscle that has been shown in particularly in patients with chronic or long-term lower back pain to have been atrophied, or is smaller, essentially is wasted compared to pain-free controls, compared to subjects of people who don't have chronic lower back pain. And also there seems to be a sort of delayed firing and function of those muscles in people with lower back pain. You can see actually that it extends, let's zoom out a little bit here, right from down at the sacrum all the way, all the way up the, a fair chunk of, let's just fade some of this, a fair way up the length of the spine. And then there's our back wall. If we then look at the front of the spine, so we come to the front of the spine, we've got a lot of people, I think you guys might be familiar with this one. This is the transverse abdominis. Also, we could think of it as the front wall, but you could also think of it as a belt, a kind of an internal belt, internal corset, if you like, of that middle layer of the core. And as far as its sort of origins, it's coming off the anterior aspect. Let's just fade the others for a second. Of the coming off the pelvis here, off the innominate or the anterior aspect of the pelvis, the inguinal ligament, which is just this ligament crossing through here. And then we have attachments up into the ribs. Actually extends a fair way up into the rib cage, ribs, the articular cartilage of, essentially you've got 12 ribs and it attaches into ribs 6 to 12. Also, to a degree, into the thoracolumbar fascia. The thoracolumbar fascia being this sheet of connective tissue here. We have a link of the transverse abdominis going into that essentially kind of posterior or weightlifting belt at the back, helping to provide some stability there. So that makes up the pelvic floor being the floor, diaphragm being the ceiling, multifidus being the back wall, and transverse abdominis being the front wall, gives us our core cylinder. And what they do together is that when they contract, they increase intra-abdominal pressure. They all almost create this decompressive effect of the spine, so that when you take on any kind of load through your spine, whether that's a barbell lean back or whatever it may be, it helps to limit the amount of strain that goes through the actual spinal structures themselves, like the vertebrae and the discs.
All right, so we're now at the deepest layer of the core, and we're going to be talking through these small muscles. And I want you to just to make it easier to remember. Think about this very broad concept of the big muscles and the small muscles, or the more superficial muscles and the deep muscles. Now, when you think about it that way, and if we compare the spine to the shoulder, the big superficial muscles, like the deltoid here, are going to produce the bigger motions, the visible motions. So when I lift my arm up like this, my deltoid is doing that motion, the large motion. But inside my shoulder, you've got the rotator cuff, the small stabilizing muscles that steer the ship, that keep the ball centered in the socket, while the big muscles, the deltoid on top, actually produces the motion. So if you think about the rotator cuff as preventing any kind of aberrant motion, controlling any excessive or unwanted motion, like the ball riding up into the top of the socket, that's what those smaller muscles are trying to do. They're trying to control and limit and minimize any excessive unwanted mini motions. That's the way I think about it. That's exactly what these smaller muscles in the spine are doing, except instead of it being like this in the shoulder, it's here are our vertebrae, so one stacked on top of the other. So if you were to kind of bend forwards to stop the vertebrae from this kind of motion from happening, or excessive kind of twisting, we've got these small muscles, excuse me, that limit and control that. So try and keep it simple here. We've got the interspinalis muscles, first of all, which go from the spinous process. If you poke yourself in the back and those bony bits right in the center that stick out, those are the spinous processes, and these muscles go from essentially one to the next. So they link from one bony point to the next one down. So those are the interspinalis muscles. We've then got the intertransversari just adjacent to that. So if you come out slightly, we've got intertransversari on those sides. And I need to take you a little bit higher up to see the rotators. So these muscles, as you can kind of just tell from the anatomy, and these types of muscles are going to be the ones that control rotation, so control those motions in the transverse rotational plane, any excessive or unwanted rotation, whereas the other ones are positioned to be able to control our vertebrae in the more sagittal plane, that kind of forward, front, back, or side to side type motions, the frontal plane, controlling any of that kind of excessive shear or sliding motion in either of those two planes of motion.